do, baby? No, just hey y'all. So look, let's get into this video, right? I don't want to sound like I'm the nurse that's complaining, so please y'all don't think that this is that kind of video. I'm not complaining about being a nurse, okay? I'm just going to go over some of the hard parts, okay, about nursing. And again, I'm an LPN nurse, so for me, my struggles, I can only speak for struggles as being an LPN. I mainly do rehab nursing, long-term care nursing. I have done hospitals, I have done home care, I've done assisted livings, but let's be real, y'all, where the coins are, especially for LPNs, is rehab nursing and long-term care nursing. So that's what I have the most experience in, okay? So let's get into this video, okay? So some of the struggles as a nurse. All right. Again, speaking for long-term care nursing, LTC nursing. Let me just see that. Let me just say rehab LTC. So that can go for RN and LPN in this situation. But again, I'm speaking from an LPN perspective. Okay. All right. So let me see. I keep looking over here, y'all, because I got my little notes. Okay. So I will keep looking over there, look at my notes. All right. So one of the biggest struggles, of course, that happens everywhere, is staffing. That's common, or lack thereof, is staffing. So of course we're working with human beings. We're not working with making bottled water. Like, we not working with that. We work with humans that have to be taken care of. So at the end of the day, whether it's 5 people on that schedule, only 3 show up, we still got to take care of them people. So we get a lot of short staffing. People are burnt out. People are tired. People are overworked. But yet at the end of the day, because we care, the people that do come to work, we give it our all. You know what I'm saying? And it leads to even more burnout. It leads to even more fatigue. So it just leads to more of those issues. But yeah, that understaffing. I don't know if I said over, I meant under. The understaffing is a lot, because the family, of course, we can't tell them, oh, we don't have enough CNAs, or one of our CNAs called in, or one of our nurses, you know, is not going to be here until 5, or she's not coming at all. Like, we can't tell family or the residents that. Yet we still have to work as though we are fully staffed, regardless of the staffing ratio. We still have to go into every room with a smile on our face. We still have to give our best level of care that we can, whether we are struggling or not, whether we have proper staffing or not, you know. So the families, you so badly, I be want to say, look, now we short. We short, we doing the best that we can, but of course, you know, we can't say that. But you know, one thing I do say, I'm not gonna lie, be honest, like, if it's supposed to be 2 nurses and we short staff and they got me running from this hall to that hall, I do, you know, communicate to the residents and to the families, hey, you know, my apologies for not being here sooner. You know, I'm you know, taking care of this hall and the other hall, so I'm trying to make sure everybody is taken care of, because all of you guys are my priority. That's how I get away with telling them we ain't got enough staff. Okay, so tell them, bear with me, we got enough staff. So of course that's one of the issues, is staffing, understaffing, short staffed, and that can be anywhere, but I just think it's really intense in healthcare, because we're working with people, we're working with health, so it can be real critical. If you burn a burger because you short staff and they get too inside, you can throw it away. That's not the same when it comes to human and taking care of humans. So another problem that bothers me is not having the tools that we need. Now, it's one thing to be understaffed. We still gonna do the best that we can. We still gonna make sure these people are alive, they taken care of, they are fed. But when you don't have the tools that you need to do your job, and that's in any situation or in any field, that is like the worst, y'all. That is like the worst. These are real life examples I'm going to give you guys. I've been to facilities where there is no lancets in the building. I've been to facilities where there is no test strips in the building. So you have, I don't know how many people who are diagnosed with diabetes. You have an order for us to check their blood sugars. Some people 4-5 times a day, just being honest. No, not 5, maybe 4, 3-4 times a day, because with meals, and some people get it at bedtime as well. So you want us by order of the doctor to check these blood sugars, but you don't have lancets, you don't have test strips. And I'm not talking about not in the car, I'm talking about not in the facility. So if on my car I don't have the tools I need, I don't have lancers or test strips, but I have 4 diabetics, I'm not like that. Hey, I go to another nurse, hey, you got a test strip, you got a lancet or 2 that I can borrow. I know how to make it work if I have to, but number 1, we shouldn't have to do that. Number 2, you're not supposed to do that. And number 3, it's a problem when I go to another nurse and she's struggling too. She got 3-4 people with, the diagnosis of diabetes, and they have to get their blood sugar checked and they have to receive insulin, but she only got like 3 test strips too. So what I'm supposed to do? Ask her for 1 out of her 3 when she already low? So that's yeah, what are we supposed to do in those situations? Like, seriously, what are we supposed to do in those situations? Because that's a real life situation that happens to me. You call DONs, people don't answer after hours. They don't call you back. And it's like, okay, but these are time sensitive, health sensitive matters. These are real situations, not having the tools that you need. Unless you're in the hospital, you got to bring your own vital supplies. Like, you have to. They do not have, listen to me. They do not have, unless you're in the hospital, vital supplies. I used to be that nurse that was like, well, if you want me to check the blood pressure, then you need to supply me with the blood pressure cuff and and you need to have this in the building. Good luck, sweetheart. They'll give you one of those disposable cups. Like, they are not investing their money into Dynamaps anymore. Any of those things. Like, for me, let me show y'all real quick. Hold on. My bag. It's my little nursing bag, okay? I ain't little, it's big. My nursing bag. This is what I bring to work every day. Right here. Oh, let me show y'all. My Old Faithful, okay? Of course, you got your stethoscope. I got a couple of them. You got to bring your own, of course. I have to bring my own blood pressure cuff. And my highlighter that fell. My own blood pressure cuffs. Let me see. Thermometer. 97.9. I'm good, y'all. My own thermometer. My own post socks. Like, we have to bring our own vital supplies. My wound care scissors. Look, I even went, look, you go to Walmart, because y'all think I'm playing about that story I told y'all. You go to Walgreens, go to Walmart, go on Amazon, be having to buy your own stuff. Like, because at the end of the day, that life, that resident, that patient is in your care, in your hands. Like, how do you got to bring your own stuff? Like, that is so crazy to me. But let me see what else I got in here. I got a little bit of everything in there. But that's just an example. Like, you legit have to bring your own supplies, because they will have orders for things that they don't even supply you with the tools to do your job. It's been times I went to a number of facilities where we have orders for wound care orders, and let me put my little stethoscope on. Y'all know I'm a little bougie. Hold on. I've been to facilities and places where We have wound care orders, but we don't have wound care supplies. Like, so we have to, like, I don't want to say it like that. We have to rig up some stuff. Like, acetic acid don't have that, so it's like we have to figure something out with that. If you don't have certain dressings, you have to figure something out with that. And it's like, yes, okay, we know how to problem solve, we know how to think critically, but we shouldn't have to be put in those situations where we don't have the tools that we need to do our job. That's not okay. That's not okay. And it's an everyday thing. It's the new norm, and so people are like, well, that's everywhere, but it's still not okay, y'all. Like, that's the reason why some people in some facilities feel like they can do whatever. It's because we keep letting them, we keep allowing it, and we don't speak up on things. You have to speak up on things, okay? Now that one got me. I told y'all that got me. Like, you have to speak up on things. When I don't have the tools I need to do my job, that bothers me. Number one, if you don't have the wound care supplies for a wound care order, how is that wound supposed to heal? How is it supposed to heal? Especially, it's already hard for people with certain diagnoses and comorbidities that it already slows down the healing process. So now with that, you don't even have the tools. Like, it's crazy. It's crazy. I've had to go to Walgreens and get wound care supplies. Like, I've had to do that, and it sucks. We should not be doing that. Let me fix this a little bit. There we go. We should not be doing that. But again, that's one of the struggles that we have as nurses. I mean, not having the tools that we need to do our job. Okay, next topic. I'm just saying, like, that bothers me, so I just spend a little time on that one. Okay. One thing also is, like, damn, I don't want to sound like I'm lazy. I'm not lazy, y'all. But when I say overworked, that's everywhere, right? But let me give you a situation. When you are on rehab, not long-term care. Long-term care is different from rehab. So these numbers are different. 20 patients on long-term care is different from 20 patients on rehab. So if I have 20 patients on rehab, that comes with some IV medication. You may have some tube feeders, but that come with more, not acute, but of course subacute, but they're more unstable than people that are in long-term care, if I'm making sense with it. So the acuity is different from long-term care than rehab. Anywho, so if I have like 20 plus people, I don't have no med tech. So if I am passing medications for 20 plus patients on a rehab unit, have to do wound care for I don't know how many of people, you know, because a lot of time on rehab, you have people that are like post-op. You have a number of different like people that come from the hospital. So these are people that need you, okay? So you doing wound care, you doing medication, or you definitely doing some skilled charting, because rehab is a moneymaker. So they're gonna make sure that they have it scheduled for you to do your charting. What else do I have on here? And not to mention admissions. I got one, maybe two open beds, and you gonna keep filling it, knowing that you don't have enough people to take care of these people. But throw an admission in on that. And how many times do you go to a facility and they actually be like, oh, just letting you know, we have an admission coming today. First of all, you know ahead of time about your admission. Not you as the nurse, but the facility know, because it's a process to get them admitted. It's a process when people do referrals. It's a process of making sure that their insurance going to pay, and if not, it's a process. So you know ahead of time that these people are coming into the building. I'm walking down the hall, I'm doing my medication, and I just see a name on the door. That was an empty room when I started my shift. How a name on the door, and next thing you know, somebody pulling up on the stretcher. I don't have no report. I don't have nothing like that. That happens so often, more often than you guys know, okay? Or if you in nursing and you especially do rehab nursing, you know that this happens. Nobody really tell you that there's an admission. Sometimes one facility I went to, they had the whole building was rehab. So we know admission and discharge happens. And this is how they tell you an admission is coming. Oh no, I ain't gonna put that paper up. That's important paper. Oh, shit, I don't know. They put the paper at the nurse's station. Mind you, I'm down the hall, sweetheart. I'm doing medication. I'm doing wound care. I'm making sure the CNAs do, getting the showers done, making sure we getting these daily weights on everybody, because when you a new admission or when you in rehab, they constantly want weights, which is understandable. But I'm making sure that I'm doing my duties as the floor nurse. So at what point do I see you stick that little paper up there? At least you'd be like, hey, just letting you know you got a mission coming today. I put the paper up there. They put it up there and run, y'all. They run. They stick that paper up there and run. So yeah, it's crazy. Like paramedics pull up with the patient and you just like, oh, who's that? Oh, this is so-and-so. Oh, what room are they going into? And it's like, you look like the slow one because number one, you didn't know they was coming. You don't know what room they going into, but you accepting this patient. You have to sign that you accepting this patient in the middle of doing your med pass, in the middle of doing your wound care, in the middle of everything that you got going on. So those balls get thrown into it, okay? Y'all, we deal with a lot. We deal with a lot, but you know what? We care, so we do it. We care, so we do it. But look at me, I almost had a moment. Let me drink my water. But we deal with a lot. And I know people might say, well, if you don't like it, go to a different setting. That's true. Go to another setting. But let's be real. We want our coins, so we deal with what we deal with. When you are an LPN in a hospital versus an LPN in a rehab or long-term care, that pay is different. When you are a nurse in home care, working in clinics, like those pay rates are dramatically different than what they are working in those facilities. And of course, there's a reason why. I get it, y'all. I get it, but that don't make it okay for it to be that dramatic of struggle that we have to go through working in those facilities. Okay, what's another one? What else I got on here? And this other one, it's not really a struggle, y'all. Like, it's not really a struggle, but it is kind of annoying. Like, let's be real, it's kind of annoying. Everything is nurse. Everything is nurse. The TV not working, guess who they gonna call? They gonna put that call light on so quick. CNA gonna come in there. He's like, I need the nurse. The CNA ain't gonna ask what for or nothing like that. They gonna come and get us. We go in there. Hey, how can I help you? Blah, blah, blah. Oh, my TV isn't working. They need the nurse because the TV ain't working. I have one situation where I was walking down the hall, y'all. This is a recent situation. I walked down the hall with the med card, busting out my medications, getting them done, and I came back to the med cart and doing medication, and I heard a resident that's on the rehab. They came out of their room because they saw the person putting laundry up, and they asked the laundry person. They said, well, what do I do if I need clothes washed? They legit, listen, y'all. They legit said, you have to let the nurse know. You have to let the nurse know. That's what the laundry person told the patient regarding her getting her laundry done. So I had to ask her, like, I didn't want to bust her out in front of the patient, but it just like, okay, that annoyed me low key. So I'm like, okay, so why, can I ask you why they have to let the nurse know, when they need their laundry done? They said, what did she say? She was like, well, because, somebody have to put it in a bag and throw it down a laundry chute and da-da-da. And I'm like, but do it have to be a nurse? Like, I was kind of annoyed that day, y'all. Like, do it have to be a nurse? Gotta be a nurse to do that? Like, you the laundry. Like, you laundry. Like, you know what I'm saying? Like, you do this. You can't offer her a bag. You can't do nothing besides tell her ask the nurse. And it's like, those are like small things, but when you already have enough on your plate and enough you're responsible for and enough you have to tend to, all those little things add up. It's just like going to Dollar Tree. All this stuff is $1.25 now, and they're all little things, but by the time you get to that register and that total come up, sweetheart, you're like, dang. So all of these little things, like, they add up. They add up. But we do it, y'all, because we care. We do it because going to other settings, you may not get the same experiences, you may not get the same excitement, you may not get the same pay. So we do it. But listen, it's certain struggles definitely can be fixed. Certain struggles can definitely be worked on, i.e. not giving us the tools we need to do our job. Okay. Hoping that this video don't discourage anybody. Again, this is not me like trying to discourage anybody. This is not me trying to be negative about nursing. It's just, I mean, as a nurse, sometimes you just have to vent a little bit. I still love being a nurse. I still love going to work. Not every day, but yeah, but I still do love going to work. So, you know, we still doing this. I don't want this video to discourage anybody, but I feel like if you are a nursing student or you looking into getting into nursing, you should know what you're getting yourself into, because we all get on these platforms and they make nursing look so cute and so fun and so funny, and we're doing the TikToks. You see where they doing the TikToks at, right? Nah, I'm just playing. All right, you guys, I'm going to come to you with another video. Like I said, I'm going to keep trying to be more consistent with uploading my videos. I am in my, I got 3 weeks left in this semester, so I'm still in school, so I'm not gonna be able to do it as much, but when I can, I'm definitely going to record and upload videos for you guys. So nice talking to y'all. If y'all have any questions, drop them below. I do read the comments, and you know, any questions that you have, I can definitely make more videos about it. Bye.